Good afternoon, everyone, and thank you for being here. I'm joined, as usual, by Dr. Joe Cantor of the Louisiana Department of Health, and he'll go through some slides with you that point out in more detail some of the data that we use to inform our decisions on the proclamation that we will be putting into effect tomorrow. Overall, from a high level, we continue to see several months now of sustained improvement with COVID hospitalizations and an increase in the supply and availability of the vaccine. And by that I mean the doses we are receiving are considerable. We have more enrolled providers than ever around the state to actually administer the vaccine. I think that number is actually over 1,500 now. And I think you're going to see that there are, over the last couple of weeks, some small increases in the incidence of COVID in Louisiana, which concerns me and should concern all of us, especially when you put it into the context of the variants that are out there. Our baseline numbers, however, continue to be low, and in the grand scheme of things, relatively flat, as you'll see shortly. And we've made decisions in the past on very high baseline numbers as a reason to keep restrictions and mitigation measures in place, even if we had a couple of weeks where the trajectory had been improving. And so with basically flat or small increases with the very low and stable baselines, I've decided that we are going to take some steps in further reducing restrictions and mandatory mitigation measures. Another positive trend is the very steep decline in COVID deaths of people 75 and older, our most vaccinated group. And it's now been more than a month since Louisiana opened up vaccine eligibility to everyone 16 and older, regardless of occupation, regardless of any underlying health condition. We were one of the first states to do that. Today I can report 26% of Louisianans are fully vaccinated, and that includes more than 67% of those who are 65 and older. Now, on the one hand, we're very thankful that that number of people have chosen to be vaccinated. On the other, I can tell you that's not where we need to be, and we're going to have to continue to work hard to increase those numbers. But it is a good start, especially for our older and more vulnerable populations. So taking all this into account, we're going to be making some changes to the proclamation. I signed it a few minutes ago. It goes into effect tomorrow, and it'll be in effect for 28 days. Instead of a blanket mask mandate, we'll be allowing local leaders and business owners to set their own policies regarding masks. And, of course, that's not any real change in the law. Private property owners always get to do things like that are more restrictive, and certainly local political leaders have always had the ability to be more restrictive as well. I will tell you that because of a federal mandate, that masks are still going to be required across the state of Louisiana on public transit. It will still be required in many state buildings and at K through 12 schools in consultation with Superintendent Brumley and others in K through 12 education, and colleges and universities, and then all healthcare facilities licensed by LDH, because you certainly have a preponderance or a large number of individuals in those settings who are vulnerable to the disease based on their age and or health condition. And that does include nursing homes, which I think everybody can agree, especially since it was early in the pandemic, 40% of all deaths were happening in nursing homes. But I will tell you, I am very heartened at the improvements that we have made in nursing homes, and I think you're going to see some slides in a little bit from Dr. Cantor that will illustrate that. For state buildings, the mask mandate will stay in place. However, the head of an agency may opt out in writing to the Secretary of the Department of Health and just put a clear sign up at the doors that they have opted out. Now, even if they were to opt out, obviously people have the ability to wear a mask inside that building should they choose to do so, and I would recommend that they do that. All of my cabinet agencies will be keeping mask mandates in their buildings. It was just yesterday that I received a report of a DCFS worker who actually died from COVID, and so we're going to keep the mask mandate in buildings that are controlled by state agencies that work for me. We know that masks work. The evidence is clear. The science is well established now, and we've seen a very positive impact on our state. But at the same time, we've had a mask mandate in place since the middle of July of last year. I think it's now intuitive for people to wear a mask in order to protect themselves in higher risk settings and also to protect others. And you may remember that early on, when masks were first recommended, it was all about protecting others. And then they realized that there's actually a benefit to the wearer of the mask because they achieve some protections from the virus as well. Fortunately, we have a lot more tools for slowing the spread of COVID than we and the controlling the impact of COVID as well than we did even a few months ago. And these include better treatments and, most importantly, several highly safe and effective vaccines. The three, Pfizer, Moderna, and Johnson & Johnson, all of which are available today in Louisiana. And again, anyone 16 and older is eligible to receive a vaccine. And just like other states that have lifted the mask mandates, it's not an end to mask wearing. It's not an end to recommendations that people wear masks, especially if they are vulnerable, if they're unvaccinated, or if they live with people who are vulnerable and unvaccinated. But I think it is a reflection of where we are at this stage of the pandemic. And I saw something the other day, Dr. Canner showed it to me, and I wanted to relate it to the public, all the people of Louisiana, that if it's a rule of thumb to try to determine in a particular situation whether you are relatively safe. And when in doubt, first thing you ask is everyone around me vaccinated? And you may or may not know the answer to that question, and there's a good chance you won't know. So then if you don't know or you're unsure, use the 2 out of 3 rule in order to slow the spread and make sure that you are as safe as you can be. Make sure your activities meets 2 of the 3 following conditions: outdoors, distanced, or masked. And if you're outdoors and you're distanced, you don't need to wear a mask. But if one of those 2 things isn't present, then, and you want to be safe, you need to wear a mask. I also ask all Louisianans to make sure that they are considerate of businesses and other settings where the owners or maybe a corporate policy or whatever will require that particular business still have a mask mandate in place. I will tell you that I will continue to wear a mask when in public, when I am close to folks and I don't know that they've all been vaccinated and so forth. I think it's the right thing to do for public health. It's also the respectful thing to do. And am I vaccinated? Yes, I am fully vaccinated. But Dr. Canner briefs on breakthrough cases all the time. And there is no guarantee that I or anybody else fully vaccinated won't contract the disease or become contagious. And so especially if I'm around people who are not vaccinated, I will, and in small groups, then I will feel the need to continue to wear a mask. The new proclamation also eases some restrictions on live music, allows some businesses like salons to reopen their waiting rooms and waiting areas, and removes outdoor limitations on crowds. Indoors, event centers, theaters, conference facilities, they will be able to choose between a 75% occupancy capacity, which is more than they've had up to any point this far, while social distancing, or they can choose 100% capacity with masks, with a mask mandate in place. For all indoor sporting events, capacity is limited to 75% similarly with social distancing, or the individuals in charge of that venue can go to 100% if they want to have a mask mandate. For live music, new regulations will require 10 feet of space between the stage and the audience. And so that will obviously become something that is more readily available. I want to point out that social distancing, masking are still recommended by both the state of Louisiana and by the CDC. And there were a number of bills, if you will recall, that were passed by the legislature last year that I signed into law that confer liability protections to K through 12 schools, businesses, and so forth with respect to claims about individuals contracting COVID in those locations. But those protections are only available if the school, the business, and so forth is following CDC recommendations. There's nothing in the mask mandate that changes that law. And so businesses need to understand, schools need to understand, if you want to enjoy those protections from liability, you need to continue to adhere to those CDC recommendations. Before I invite Joe up, I do want to go through today's numbers. We are reporting 433 new cases of COVID on 23,545 new tests. It's a one-day snapshot, and the percent positivity in any given day really doesn't mean anything, but when you look at it in the context of other days, it can start to tell you something, but that's a 1.8% positivity percentage for the cases that are being reported today. The tests reported in the month of April is right at 462,000, not as high as we were previously, especially in the months of December and January and so forth, but it's still a robust amount of testing, especially relative to other states neighboring us, and well in excess of the amount of tests that we need in order to have a clear idea of what's happening around the state, especially when you look at that percent positivity. I did want to point out on this chart that you can see that Louisiana is now number 30 in the country on confirmed cases per capita. If you will remember, back in the immediate aftermath of the pandemic starting, Louisiana was number 1 for a long time. And so I want to thank the people of Louisiana. I want to thank all of our experts and the folks at the Department of Health and all of the medical providers and so forth, because with the work that we've done since then, we've actually moved from number 1 to number 30 among the 50 states and the District of Columbia. And that was certainly not easy to do, but it's an indication of the degree to which we've been able to more or less manage our response to COVID-19 up to now. And I do want to point out too that there's no guarantee that our state or any other state or as a country that we don't go backwards. And that is especially true if we don't get our vaccination numbers up. You can see some other states that are not doing as well as we are. There's certainly other countries in the world that are not doing as well as we are. Look to Brazil, look to India, for example. But I am confident that the steps we are taking today are the right things to do. Sadly, we are reporting 10 additional deaths today, and we're at a total now of 10,352. There are 308 individuals hospitalized. That's down 11 from yesterday. 46 of those are on mechanical ventilators, and that's down 1 from yesterday's report. So I'm going to turn it over to Dr. Cantor now. He'll come up and go over some more information with you all. As normal, I would ask that if you have questions for Dr. Cantor, ask those of him before he leaves the podium, and then once he leaves, I'll come back up, wrap up the press conference, and take your questions. Thank you.
Good afternoon. Thank you, Governor, on behalf of the Department of Health and Secretary Phillips, and thank you for your leadership. Now and throughout this ordeal, it's been about 13 and a half months since we had our first case of COVID diagnosed in Louisiana, and thankfully, we are in a much different place than we were back then. The overarching trend of the data that I'm going to present to you in a moment is that, as an absolute number, the amount of COVID circulating in Louisiana is considerably less than it was, and that makes for a safer environment. Low risk or lower risk does not mean no risk, and that is why, while the mandate of masking is being removed in a number of settings, the public health recommendation of masking very much remains. And I'm going to talk a little bit more about how and why that is. Next slide, please. Every time that we advise the governor on a renewed proclamation, we present the epidemiologic data that we track in the Department of Health. And what we see really across all the measures that we look at is historic lows throughout the 13 and a half months that we've been responding to and sacrificing because of the COVID pandemic. I'm going to walk through some of that data right now. On the top left, you'll see a graph that represents COVID-like illness. This is the percent of all emergency department visits that are attributable to COVID-like symptoms. This is analogous to how we track flu, influenza every year. And we peaked right around Christmas and New Year's, have declined steadily since then, and now have been relatively flat for the past 5 or 6 weeks. On the top left, you'll see incidence, which is the number of new cases diagnosed, or people that test positive, unique people that test positive, unduplicated, every day rolled over a 7-day rolling average. You can see the 3 spikes that we had in Louisiana: the initial spike in March and April, the summer surge in July and August, the very, very large Christmas, New Year's spike, and then sustained progress since then to a very low baseline level in Louisiana. We have seen the beginnings of a little bit of an uptick over the past week or so, but overall that level, the amount of COVID out there, the amount of COVID being diagnosed every day, is at a very low point for the state of Louisiana. We are currently counting 64 cases of COVID per 100,000 residents over a 7-day period. The CDC marks as high anything above 100. We're at 64 over 100,000. On the bottom left, you'll see a compound graph that I'm going to walk through. The bars, the bar graph, the orange bars on the bottom represent percent positivity, or the percent of all tests or all cases that are found positive. Last week, we reported our result to be 3.5%. As of now, and this will be reflected in the dashboard update tomorrow at noon, we are down to 2.8% positivity, which is a very, very low number, a historic low number for Louisiana. On that same graph, the purple line on top is testing volume. At the moment, we are ranking at 149 tests per 10,000 residents over a 7-day period. In March, as the governor mentioned, we had 527,000 tests conducted. On April to date, we've reported 462 1,000 tests conducted. You can see the testing volume has gone down noticeably since that surge in Christmas and New Year's. One of the things about testing is that more cases typically beget more testing. When you have more cases out there, you have more exposures, more reason for other people to get tested. People have symptoms more, it's being transmitted, and more people get tested. So we typically do see testing volume decline as cases, as transmission goes down as well. If you look around regionally, we think we're doing a good job with testing. Really, the point of this is to have enough visibility, to have confidence in these numbers and these projections. When you don't do enough testing, you can't trust your data that much. You feel like you're somewhat blinded. We are doing a significant amount of testing in Louisiana, and that gives confidence to the conclusions that we can draw from this data. Probably most notably is the bottom right graph, which is the number of hospitalized COVID patients at any given point in time in hospitals throughout Louisiana. Currently, we went down today 11 hospitalized patients to 308. That's almost a new low for us. I think we got close to or just broke 300 a couple weeks ago. But just at that Christmas and New Year's surge, that peak all the way on the right side of that graph, we hit a high for Louisiana of 2,035 hospitalized patients across the state. And we have gone down precipitously and steadily since then to 308. This is as a result of two things, really. Number one, transmission has gone down across the state. Number two, vaccinations have gone up, particularly vaccinations of people who are vulnerable, likely to be hospitalized, have gone up. That's a very reassuring number to get our hospitalizations down steadily to a number like 308. The governor had mentioned some rankings compared to other states. We get weekly reports from the White House that gives data for Louisiana and also compares us to other states across the country. I want to run through a couple rankings with you right now based on the latest White House weekly report. We are 13th lowest in the nation for new cases, day on day. We are 11th lowest in the nation for percent positivity, and that's with doing a decent amount of testing too. We are 6th lowest in the nation for hospitalizations. I think the people of Louisiana have done a good job controlling the spread of COVID. It's been the result of a lot of hard work, a lot of sacrifices, but we have gotten to a place that is much better than where we were, certainly this time last year. The other thing that's particularly changed from this point last year is we now have the strongest possible tool to protect ourselves and protect our families, and that's the 3 vaccines that the governor mentioned, the Pfizer vaccine, the Moderna vaccine, and the Johnson & Johnson vaccine. For the bulk of this pandemic, we did not have those, and we were all vulnerable and susceptible. We have these tools now, and that is an absolute gift. It is the hope and the goal and the driving aim of the Department of Health to encourage more people in Louisiana to avail themselves of those tools. Make no mistake, we have the tools now to protect ourselves and protect our families. And the reason why we can say that is because, without a shred of doubt, vaccines work. Evidence is mounting. The strongest evidence now actually comes from the nation of Israel and looking at how they've really driven transmission into the ground through mass vaccination. Vaccinations work, they drive down transmission, and they make people safer. That is not any more clear than it has been in nursing homes across Louisiana. Next slide, please. If you look at the nursing home graph over here, these are a number of new cases diagnosed in nursing homes over time. And we've marked out when the vaccination clinics were offered in nursing homes across the state. And you can see really from the beginning of the vaccination campaign in nursing homes, the number of new cases diagnosed has gone down considerably. For the past 8 weeks, we have been in the low double digits, between 10, 20, maybe 25 cases a week diagnosed in nursing homes. That's down from hundreds earlier in the pandemic. And we know the lion's share of mortality is in this type of area. This graph right here, again, as the governor mentioned, offers extraordinarily compelling proof of how well these vaccines work, and not in any setting. This is the highest risk setting there is. Vulnerable, elderly individuals in a close congregate setting where viruses of any nature can spread quickly. And look at all the progress that has been made as a result of the vaccine campaign. Next slide, please. We're also encouraged by the number of deaths and the decrease in the deaths reported day on day. Now, make no mistake, and this goes back to what I said earlier, lower risk does not mean no risk. And we still have, unfortunately, people dying from COVID. And today the governor reported 10. We'll likely report more next time that we talk. But the number of deaths, as you can see, has dropped considerably since about the New Year's and since we've been able to ramp up the vaccination campaign. It's most pronounced in elderly individuals. Next slide, please. And what you see here is two lines. The gray line is individuals aged 60 to 69. The purple line is individuals aged 70 and above, the number of deaths that they have day on day. And again, you can see since the beginning of the new year, since the vaccine campaign really picked up, fatalities from COVID in elderly individuals have dropped off considerably. These vaccines work. These vaccines work, and they don't just work for people in nursing homes. They work for everyone who takes the shot. Next slide, please. While risk is considerably lower in Louisiana than it has been at other stages of this pandemic, it is not zero. And that is an important point for individuals to understand. One of our responsibilities in the Department of Health is to be as transparent with the data as possible and give people the tools to protect themselves and protect their families. This 2 of 3 rule is one of those tools. If people want to do all they can to ensure that they are safe from COVID, an easy way to achieve that is to follow this 2 of 3 rule. And what that means is, of the 3 following items, make sure you're always obtaining 2 of those, at least 2, outdoors, distanced, and masked. If you can obtain 2 of those 3 at any point in time, you can be relatively assured that you're in a safe environment. If you're outdoors and you're distanced, you really don't need to wear a mask. If you are outdoors and you're masked, you can be closer together. If you are indoors, it's safer to be distanced and masked. If you're ever unsure if you are in a safe environment from a COVID perspective, this 2 of 3 rule, outdoors, distance, and masked, is a handy way to do a risk analysis for you and for your family. More important than this is to get vaccinated, because the single best way to protect yourself and protect those around you is to get vaccinated. I can tell you as of today, there's been 2.7 million doses of vaccine administered in Louisiana. 32% of the state's population has initiated the vaccine series. Of 18 years of age and older individuals, 41.4% have initiated. For people 65 and above, 74.2% have initiated the vaccine series. 26%, or 1.2 million Louisianans, are now fully vaccinated, have completed the vaccine series. 33.18% of those of us 18 years old and older have completed the vaccine series and are fully vaccinated. 67.6% of individuals 65 years of age and older are also fully vaccinated right now. We are also, and I'm proud to say, making steady progress addressing racial disparities in vaccine administrations, and this has been a big focus of ours in the Department of Health and on behalf of the governor and his team. Each and every week, the percentage of vaccines that have gone to Black Louisianans has increased. Slowly, and we certainly have more work to do, without question. But each and every week, we've been able to report more progress. Today, 21.8% of all vaccines administered in the state have gone to Black Louisianans. That's compared to 32.7% of the population is Black. So as a percentage of predicted, that's 86% predicted by population. I wanted to compare that to the national measure because we're doing better than the national average on this. Nationwide, 8.6 of vaccine administrations have gone to Black Americans, while Black Americans constitute 12.4% of the nation's population, or 69% of predicted. compared to the 86% predicted in Louisiana. That's the result of a lot of hard work, and I think we should be proud of that, yet know there's still much more work to do in that area. Also, the quality of the data on racial demographics is significantly better in Louisiana than it is across the country. We have racial demographic data in Louisiana, on 91% of each vaccine administered in the state. Nationwide, the CDC only has data on 55% of administrations. That also is a result of a lot of hard work that was put in by the teams in the Office of Public Health and the Department of Health. We had a White House call with other governors earlier today where we talked about vaccine allotments in the coming weeks, and it was reported to us that we were likely to receive the same amount of vaccine next week as we did this week. So this current week, we are receiving 119,730 doses of vaccine. That breaks down to 69,030 doses of Pfizer. These are first doses. 50,700 first doses of Moderna. We anticipate receiving the same amount next week. It happens to be the same amount that we received the week before as well. And I can tell you the week before that was matched by 36,560 first doses brought into the state through the retail pharmacy program. The Bring Back Louisiana campaign continues to push the vaccine efforts forward, and I wanted to talk a second about how folks can avail themselves of this. First and foremost, there's an 855 number that's open till 8 p.m., 7 days a week, that offers a lot of information and tools for people. The number of this is 855-453-0774. Again, it's open every day of the week until 8 p.m. You can get information about vaccines. If you need to be connected to a medical professional to get even more advanced information about the vaccines, that can do that. You can get information about where vaccines are available in your neighborhood. And again, as the governor said, we have over 1,500 vaccine providers across the state right now. And more importantly, you can actually get help making that appointment. So if you have challenges with computers, if you don't have internet access, you can call that number 855-453-0774 and get an actual appointment made for you at a vaccine provider close to you. To date, we've had over 2,000 people call that number, and about 800 have had appointments made for them. We are, as the governor mentioned, tracking very closely the number of breakthrough cases. And these are cases, positive cases of COVID in individuals who have been fully vaccinated, who are 14 days or longer out from completing their vaccine series. It's important to track these because while vaccines are extraordinarily effective, and in this case 95%, 95% effective, they're not 100% effective. And that's one of the reasons why we work so hard to reduce transmission across the board. To date in the U.S., there, according to the CDC, have been 7,157 breakthrough cases. In Louisiana, that count stands at 367 breakthrough cases, or 0.03% of everyone who's fully vaccinated in Louisiana. Of those 367 cases, 65% are women. 50% of those cases were symptomatic. And 21 of those 367 cases have been hospitalized. So 0.002% of everyone who has been fully vaccinated in Louisiana has been a breakthrough case that has been hospitalized. That's an extraordinarily low number. We continue also to track the variants very closely, and this only adds urgency to the vaccine campaign. I can tell you as of now, this is a similar number that was reported last week. Of all COVID circulating in Louisiana, 33.3% is the B117 or the UK variant. That's lower than the national mark of 44.7%. It's also lower than some of our larger neighbors. For example, Florida is at 54.6%. Texas is at 44.7%. We continue to have every reason to believe, based on data given by the CDC, that the 3 vaccines we have now are highly effective against this variant. And the best thing that we can do to protect against that variant is to increase vaccinations across the state. We do not have any of the B1357 variant, that's the South African variant. Of all the COVID in the U.S., 0.7% is a result of this variant. All states in our region, except for us in Arkansas, do have the South African variant. Similarly, we do not yet have any identified cases of the P1 or Brazilian variant. In the U.S., 1.5% of all cases of COVID is a result of the Brazilian variant. And in our region, all states except for us in Alabama have identified a case of this to date. It all comes back to the value and the urgency of vaccination. And the point being that lower risk does not mean no risk. And the single best way to protect you, protect your family, means that anyone who's eligible, which right now means people 16 years of age and older, should get vaccinated. As is clear from the data that we showed, particularly the nursing home data, the effects are profound. The effects are profound and save lives. So I want to close again by encouraging everyone, if you've not been vaccinated, please take the time to do so. If you have been vaccinated, I'll ask again, thank you, number one. You should rest assured that you now have a significant amount of protection. But your job is not done, and we'd like you to think of yourself as an ambassador and talk to the folks around you. Most people that are not yet vaccinated are not adamantly refusing to do so. They just have questions. They just want to talk to people. They're not there yet. But I think people that have already been vaccinated can help them get there. I'd like to ask you personally to try and do that. I'll be happy to answer any questions if there are any. Yeah, Blake.
What's the difference between the amount of first doses Louisiana could have gotten from the federal government and the amount that was actually drawn down for last week, I guess?
It's on a whole, on a cumulative level, it's about 85%. We can get you a more accurate number on the past week or the past 2 weeks afterwards. Mm-hmm. Yep.
So you said 0.02 people got hospitalized after vaccinations. Are those hospitalized for the vaccine effects or hospitalized for COVID?
It's actually 0.002%. So of everyone, split in decimal points, but it's important. Of everyone that's been fully vaccinated, 0.002% of those individuals have subsequently been hospitalized because of COVID.
We're talking about decimal points, I suppose. That was 0.03 when it comes to just breakthrough cases of all the people who have been fully vaxxed.
That's correct. Of everyone that's been vaccinated, fully vaccinated, 0.03% have had a breakthrough case. Great. Thank you.
Joe, I think you've outdone yourself today. That was the most information at a granular level that I have heard thus far. And I will tell you that we're blessed to have you and all the other folks working at LDH who are working so hard and so well. In closing, I want to remind all business owners that they can find additional details specific to their type of business and so forth at opensafely.la.gov. That's opensafely.la.gov. That's a website that we've been using for many, many months now. And I did not intend to or attempt to put out all of the information. I also want to speak directly to the people of Louisiana and say, please don't mistake the easing of the COVID-19 mask mandate as a sign that the pandemic is over. It is not. And we are not on a one-way street moving away from the pandemic either. It is still very much a two-way street. And we don't want to go in the other direction. It is still possible. And so the central things we have to do is get vaccinated as soon as we're able in large numbers and continue to control the transmission between now and then. Before the mask mandate was put on in the middle of July, we were recommending masking. You had businesses out there that were mandating masks. That will be the case after this order, this proclamation goes into effect tomorrow as well. And so I'm encouraging people in Louisiana to understand that though the mask mandate is lifted by me in most respects, there will be businesses that are going to require that you wear a mask. There will be some governmental buildings where you're going to be required to wear a mask. I hope you will understand that and comply. It is the neighborly thing to do. If you have questions about the vaccine, please reach out to your physician. Talk to your doctor. Get your questions answered. And there is a good chance that your doctor has access to the vaccine, and certainly he or she will know how to get you vaccinated. At this time, we anticipate the next press conference will be not this coming Thursday, but next Thursday afternoon. If we have a need to have one before then, or if that changes in any way, we will certainly let you know. So with that, and for the next few minutes or so, because we're 45 minutes into this press conference already, I will take some questions. Yes?
Governor, you implemented the statewide mask mandate last July. What were some of the other factors that went into your decision, besides just talking with your health experts, to lift it totally pretty much today, except for in the governmental buildings and stuff?
Yeah, well, I would take a little issue with what you're saying there. But so it's on public transit, it's K through 12, it's higher education, and in some governmental buildings, and all licensed healthcare settings. And by the way, I don't want to confuse anybody. That won't be in my order, but it will be in a public health order that comes out of LDH. It is just what I told you and what Dr. Cantor told you. We are doing much better overall. And we have, even though we're not where we want to be in terms of the numbers or percentage of people who are vaccinated or who have started their series, we're well down that road as well. And so I believe now is the time to lift the mandate, continuing to encourage people to mask, especially if they are unvaccinated, especially if they're vulnerable. And I understand that sounds contradictory, that we're going to continue to urge people to wear a mask even though I'm lifting the mandate in most respects. But it's really no different than it was before I put the mandate in, where we were strongly urging people to wear a mask, even though it wasn't mandated. And it was at that point in time, before we put the mask mandate in the session last year, for example, when the legislature enacted a number of statutes conferring immunity upon businesses and schools if they followed the CDC recommendations, which include, by the way, masking. And that continues to be the case today if they want to enjoy those liability protections. I just thought it was time to do it. And you see the number of deaths decreasing. You see the number of hospitalizations very low and stable. I think Dr. Cantor did a great job. In fact, several of those numbers that he gave you in terms of our national ranking were, I was hearing for the first time as you heard him. He teased me a little bit before we came out and told me that he had some really good ranking information. But we knew we were doing much better. And so it just seems like now is the time to do that. And again, I'm hopeful. I'm optimistic that the people of Louisiana are going to continue to respond and do what's necessary. They've done that thus far. That's the only way we could get to number 30 in the country in cases per capita after leading the nation for so long at the outset of the pandemic. It is with the cooperation of the people of Louisiana, for which I am very, very grateful. And yes, I am mindful that there are some people who haven't cooperated. But clearly we've been able to achieve a significant amount of cooperation here in Louisiana. Yes, sir.
Okay. Well, today the House committee approved the bill to legalize recreational marijuana. Now, if this lands on your desk, Governor Edwards, I mean, what do you think?
Well, as I almost always do, I will take a look at the bill as it arrives on my desk, seeing what it contains and what amendments have been added to it. And I'm not going to speculate now on that, but I do have great interest in that bill and what it says, especially if it does make it up to the fourth floor. But I'll take a look at it at that point and then make sure that you all know exactly how I feel about it. Yes, sir.
Governor, this morning on the White House COVID briefing, they talked about how in the call with governors, one of the big focuses was kids in college and universities getting access to shots if they go home and whatnot. On the college front, obviously last week LSU made this announcement, other Louisiana universities have as well, about not requiring a COVID shot for the fall semester. It sounds like LSU said they didn't think they had authority under EUA, but both private and public universities across the country have been making this decision both ways, requiring it and not requiring it. Do you have a thought process on if you'd like to see universities in this state require the vaccine for the fall semester?
Well, my thoughts are that everyone 16 and older ought to get vaccinated. That's my thought. That certainly includes all the people on the college campus, whether they're staff and faculty or students. And part of the call this morning with the White House dealt with those students who may get the first shot of a 2-dose regimen before they leave, and would the receiving state administer the second shot? And we're going to make sure that that happens, and there's going to be reciprocity all across the country so that we will give a second dose here in Louisiana to any college student who comes in having received the first dose in another state. So that was a big part of it. I will tell you that it is no secret that if you want to enroll a child today in K through 12 education, or if a student wants to enroll in higher education, they have to produce a vaccine record. I believe at some point in the future, when the FDA grants full approval to the vaccine, to one or more of the vaccines, right? But right now we're operating under emergency use authorizations. But if and when, and I believe it will happen at some point, I can't give you a timeline, that the FDA issues full approval, then I would expect then that the COVID-19 vaccine will become one of those vaccines you're going to have to show for that purpose. But we're not there yet. And that's what I understand higher education is talking about, the difference between not mandating it now. But I'm asking people not to get caught up in all that. It is absolutely the right thing to do. It's the smart thing to do. We don't put the pandemic behind us, and especially for those college students who are going to be traveling around the country because they live somewhere else, and they're going to be leaving one of our university campuses and so forth. Please get vaccinated. And some young people believe that this disease has not had an impact on people their age. They are wrong. There have been young people who have contracted the disease and had very, very serious cases, and in fact, some have died. But the other thing is, if you contract the disease, you're also contagious. And then you're going to be giving it to people out there, including your loved ones, who may be vulnerable. And so we're asking everyone to get vaccinated, and we're working very hard with all the higher education leadership, just like we are in every part of our society in Louisiana, but with higher education leadership in particular, to get as many people vaccinated as possible before the current term concludes and those students may start to travel. One more question. Yes?
Is the state capital under your sort of purview in deciding a mask mandate, or how does that work?
The 4th, 5th, and 6th floors are.
Okay.
Well, they're going to, the speaker and the president will decide what they do with their portions of the Capitol that are under their control. My recommendation is to keep the mandate in place. That's what we're going to do with the portions of the state Capitol, but also other governmental buildings that are under our control. That is for the safety of our employees, but also the visiting public. It's important to me to know that if someone's going to come in and get a driver's license renewed, which they have to do, that they will be safe, and that the state worker who is sitting at that desk to facilitate that transaction is also going to be safe. And that should be the case across the board. And I mentioned that just yesterday I learned of our most recent state employee death. It was a DCFS worker. And so I actually had a number of my cabinet officials come to me to make sure that we left the mask mandate in place in the buildings where their employees work and they engage with the public. And so that would be my recommendation to the Speaker and to the President, but they will decide for themselves, as will other statewide elected officials. Look, I want to thank you all for continuing to cover this. Obviously, we're in a better place, but we're not in the best place. The best place is when the pandemic is over. That is not today, and we don't get there until more people get vaccinated. And until we can end the pandemic, it is incumbent upon all of us to slow the transmission. We are still reporting deaths every single day. I have not had a day since early March of last year that we didn't report a death from COVID. I am looking forward to that day. And by the way, when we get to that day, we're still not going to be where we need to be, but it will be yet another indication that things continue to improve. So thank you all for covering this. And I want to finish by doing two things. Again, thanking the people of Louisiana for working as hard as they have to help us control the transmission so that we can have the numbers that we showed you today that make this decision possible. I also want to ask you to please get vaccinated. And thirdly, continue to lift up our state and one another in prayer, but especially those family members of the more than 10,000 people who have died from COVID. And if we work hard and we work fast and we work smart, that number doesn't have to grow much beyond where it is right now in Louisiana. Thank you all, and God bless.